Manic depression is the name which was once used for a condition called bipolar disorder. Bipolar disorder is the official name of this mental illness characterized by extreme polar mood swings. The mood swings in themselves are not the only issue. A lot of people who suffer from depression or anxiety also experience mood swings because the two conditions frequently overlap. Though distressing, they are not quite as alarming as bipolar disorder. The difference with bipolar disorder is that the moods are frequently inappropriate for the situation. A person will laugh uncontrollably when someone is hurting or become extremely violently angry for no apparent reason. These are instances of mania, the term which describes the high end of bipolar mood swings, which is not a euphoric time in the least. Mania and bipolar disorder. When one refers to a manic episode, it is not necessarily a time of fantastic energy and joy. An individual might be more sexually energetic, but her appetite could be unhealthy and exhausting for her partner. Because she is not thinking sensibly, she might have several partners, putting her health and theirs at risk of contracting a sexually transmitted disease. She could be energetic, but to the point of exhausting herself. In fact, what looks like energy is usually restlessness. This is the inability to sit still for any period of time, even if a person wants to. Everyone should be able to sit and concentrate at some point during the day, or at least most days, especially if she wishes to hold down a job or complete a college course. Though everyone has irritable or anxious times, these should not endure for weeks, months perhaps. When someone is having a severe manic episode, it can go on for a very long time. Such behavior is not just uncomfortable to witness. It is hard to take, especially for someone at the wrong end of an irritable individual. Also, sleeplessness is another problem bipolar disorder causes. When untreated, insomnia can persist for much of the manic period, contributing to irritability and the eventual depression that follows mania. In severe cases, someone with bipolar will also imagine things. She could be someone famous or rich. Her delusions could turn violent, especially if she is also feeling irritable, paranoid, and experiencing constant headaches. The cycles of bipolar disorder range from almost constant to several-month intervals. The downward cycle. The downsides, while less exhausting to watch, are more emotionally exhausting. Whereas mania causes thoughts to swirl out of control, the depressive episode makes it hard to form a single thought or completely reach a goal. Concentration is difficult and lethargy sets in. A morbid attitude is common. During a spell of depression, which can also last a very long time, one will talk about how she would die if she could choose, or how she would end her life. This is scary and should be taken seriously. Despair and guilt will eat away at a person's reason until he cannot think of a good reason to stick around. Suicide is a tragic way out. In the society of others. Antisocial behavior is a common side effect of manic depression or bipolar disorder, one which might be an early warning sign to friends and parents. The disease is reported to begin during mid-teens or early 20s, so if your teenager is suddenly spending too much time in her room, consider the possibility of a mental illness, not just hormonal adjustment. Start a conversation about her social life, even if only to eliminate the possibility that she is depressed, anxious, or bipolar. During 20-something, a change from vivacious social butterfly to lonely ghost will be even more obvious and should tell her friends that something significant is happening. Rather than taking offense, consider probing this person for concrete answers, fending off her insults and aggression to get to the bottom of this sudden and disturbing change. Finding direction. BD is not an automatic ticket to an insane asylum. There are always extreme cases where medication is not sufficient to help someone, but these instances stand out because they are rare. Most people respond to medication. It might take a while to find the right pharmaceutical, a correct dose, or a good balance of complementary medications, but this can and will be done whenever a patient is committed to his ongoing health. More help is needed besides taking medication, however. After what have probably been years of going through ups and downs, a person has probably learned coping mechanisms such as isolating herself, refusing to join social groups, and maybe self-medicating. Antisocial tendencies can be reversed with practice. Addictive behaviors can also be reversed once the bipolar disorder is under control. To relearn appropriate social behaviors takes determination, but retraining takes place all the time. Numerous counselors post bipolar disorder or manic depression as one of their specialties. They also indicate some of the treatments they offer, treatments that include cognitive behavioral therapy and neurofeedback. The latter of these is a method of changing the direction of a person's brainwaves. The former retrains the brain with consciously renewed thought patterns. Treatment is typically an outpatient scenario, with doctors and psychiatric professionals contributing to ongoing care. In certain parts of the country, residences exist to support individuals with mental illnesses which exist on their own or which co-exist with other disorders. Co-occurring disorders could include substance abuse or disordered eating. Psychiatric clinics run by appropriately equipped public hospitals also provide residential treatment to help individuals with mental diseases such as bipolar disorder to learn how to cope with their illness. Since bipolar disorder is going to cycle back and forth, it is important to know how to recognize the start of a new phase and also be ready to deal with it when it comes without reverting to negative habits of the past.